Iodine is a trace element that is naturally found in some foods, added to others, and available as a supplement. Iodine deficiency has re-emerged in Australia due to new practices of sanitation in the dairy industry and a decline in consumption of iodized salt. As the most common preventable cause of brain damage and mental retardation, sufficient iodine is necessary to obtain through the food supply. In this video, we will have a look at the functions of iodine in the body and why it is necessary for health. So, iodine is essential for the thyroid gland to function properly and to be able to synthesize the thyroid hormones, thyroxine T4 and triiodothyronine T3. Thyroid cells pick up iodide ions from the blood and transport them into the cytosol, where they get synthesized into T4 and T3. So thyroid hormones are responsible for regulating body and brain growth and development, body temperature, energy levels, and metabolic functions by stimulating the use of oxygen to produce ATP. Thyroid hormones also stimulate the synthesis of sodium and potassium pumps, an important contributor to action potential produced by nerve cells, which uses large amounts of ATP to move sodium and potassium ions across cell membranes. So iodine is important for normal growth and development in children in pregnancy, and it prevents physical and mental retardation. Even though studies are limited, high doses of iodine supplements have shown to reduce the symptoms and pain of fibrocystic breast cancer. So although iodine is a trace mineral and only small amounts are needed, it is necessary to get it through the diet regularly to be able to store it in the body. So the diagram to the right shows the recommended daily intake of iodine in Australia. The main sources of iodine are of marine origin, such as seafood and seaweed. So iodine deficiency is related to a number of growth and development disorders such as cretinism and goiter. Cretinism is the result of severe iodine deficiency during pregnancy and can lead to irreversible mental and physical retardation in infants. Unborn babies and young children are at greatest risk of iodine deficiency. Low levels of iodine intake is associated with hypothyroidism and goiter, which is an enlargement of the thyroid gland. The hypothalamus regulates thyroid hormone production by controlling the release of TSH from the anterior pituitary. When there is insufficient amount of iodine, the body remains the elevated TSH levels in order to increase the uptake of iodine in the blood. If the deficiency continues, the cells of the thyroid gland enlarge to trap as much iodine as possible and shows up as a lump in the neck in form of a simple goiter. So the production of thyroid hormones increases by approximately 50% during pregnancy, making sufficient iodine intake extremely important for proper fetal development. This requires an increase in maternal iodine intake as the fetus is entirely dependent on maternal thyroid hormone production. Sufficient intake of iodine after birth is also important for normal physical and neurological growth and maturation. The bioavailability and absorption of iodine is related to dietary intake and systemic needs for iodine. However, the utilization of absorbed iodine is influenced by excessive consumption of foods containing goitrogens. Goitrogens are substances that interfere with the synthesis of thyroid hormones and are found in vegetables such as broccoli, cabbage, and Brussels sprouts. The levels of iodine in plants and vegetables vary depending on the environment and soil in which they are grown. Iodine is therefore added to table salt and non-organic bread as iodized salt as a mandatory fortification in Australia and New Zealand. In 2007, a study showed that most Australian population is or at risk of becoming iodine deficient. It also showed that pregnant and breastfeeding women do not get enough iodine. The National Health and Medical Research Council recommend that all women who are pregnant, breastfeeding, or considering pregnancy to take an iodine supplement of 150 microgram a day to make sure the needs are met, whereas the World Health Organization recommends a daily dosage of 150 microgram a day of iodine supplement for pregnant and lactating women. So excessive intake of iodine can cause some of the same symptoms as iodine deficiency, including goiter, elevated TSH levels, and hypothyroidism. Hypothyroidism can also result from high iodine intake, usually when iodine is supplemented to treat iodine deficiency, which can lead to the thyroid gland becoming overactive. So the upper level of intake is over 1,100 microgram a day for an adult. A sufficient iodine intake is critical in all stages of life to maintain health and for the thyroid gland to make thyroid hormone. So thyroid hormones play many important roles throughout the body, such as turning food into energy and regulating body temperature. Iodine has shown to be paramount for normal growth and development and is necessary to prevent physical and mental retardation in children. Pregnant women and young children are at higher risk of iodine deficiency. By ensuring an adequate intake of iodine is met through diet or by supplementation, iodine-related disorders are prevented and the thyroid gland will be maintained to make sufficient hormones so all the cells and tissues in the body can work properly.